Hi, my name is Ellie Gordon. I'm a graduate student at the University of Florida studying clinical and health psychology, and I'm here with Dr. Glenn Schiraldi, who's going to talk to us about resiliency, which is a super important topic for any person who experiences any kind of stress. So you're in for a treat. Dr. Schiraldi is a world-renowned expert on resiliency and trauma. He has received his PhD in health education from the University of Maryland, and he is the founder of Resilience Training International. He served on stress management faculties at the Pentagon, the International Critical Incident Stress Foundation, and the University of Maryland, where he's also received several teaching and service-related awards. He's trained clinicians, lay people, students, and high-risk groups such as police, military, and firefighters in resilience and trauma. He has also written 13 books translated into 16 different languages, including the Self-Esteem Workbook, which I love personally. That's been super helpful with my patients, and the Post-Traumatic Stress Disorder Workbook and the Resilience Workbook. So, without further ado, Dr. Schiraldi, thank you so much for joining us. It really is an honor.
It's a pleasure. Thank you.
So we'll start off, first question, very basic. What is resiliency? How would you explain that to kind of the average person?
I love to ask that question to people that I train, and often people come up with some really good definitions, and they'll usually mention characteristics like strength and grit and toughness and bouncing back, and that's all part of it, but there's probably hundreds of definitions, and so the one I've kind of settled on is resilience is those inner strengths of mind and character that help us respond well to adversity. And those strengths are inborn. Everybody's got them at different levels of development, but we're capable of growing those strengths. And kind of the why of why resilience is important is resilient strengths and skills help prevent all the stress-related conditions, depression, anxiety, problem anger, PTSD, ADHD, substance use disorders, the list goes on and on. And if people tend to get symptoms of those things, they tend to be less severe with resilience, and they tend to recover better with resilience. And then there's another side of that coin that's the beautiful thing about resilience, and that is that resilience helps us feel and function at our best at all times in life. So, we think resilience is something that's important during tough times, but it's also every day useful for us.
Mm-hmm. So everyday things like if I don't get the parking spot I want, resilience can help.
Just handling everyday stress to traumatic stress, and sometimes it's good to learn those skills for everyday stress so that when the big stuff comes down the pipe, we're more equipped to deal with them.
Yeah, that leads to my next question that wasn't written down, but how do we develop resiliency? So you mentioned practicing with day-to-day small stressors.
I look at mental health skills as just that, they're skills, rather than something we're born with, or we don't. And just like golf or piano, we get better at skills through practice. And the sooner we learn those skills, the sooner we start those skills, the more likely we are to master those skills. And so resilience can be taught in basic training. It can be taught in the fire and police academies. Better yet, it can be taught in the schools. And most of these skills are not jet science. It's not brain surgery. They can be started in first grade and taught in the home by parents, by teachers, by coaches, by managers of the workplace, by peers teaching their coworkers. This is stuff that my dream is to get this out of the clinic and put it in the hands of people that need it well before they're in crisis.
Mm-hmm. Yeah, that's super important. I think that sometimes it feels like with all that you hear about all the hurricanes and the earthquakes, and on top of that, just abuse and shootings, and not everyone is going to face super traumatic experiences, but we all have stressors day to day. But how do you recommend we prepare ourselves to be ready for when those stressors come, whether it's the big ones or the small ones? For example, when you train people, what do you have certain exercises that you kind of start with that people can do on their own?
Yeah, we start by there's 9 keys to sharpening the brain because the brain is kind of what regulates our ability to control emotions and arousal. And so there's like 9 keys that run from sleep and exercise and nutrition to avoiding certain substances and that's kind of didactic stuff. But then there's skills. There's skills to manage our arousal. There's skills to manage strong, intense emotions. There's what I call spiraling upward skills because when people are happier, it's not just a gift that's innately useful, but it also helps us to function better under stress, be less prone to depression. And so they're just skills. So every day, like when I would teach this at the university, it was every day was here's a principle, here's a skill, let's practice it, go home and try it on your own, come back and let's process how it worked, for good or bad, and kind of uh, fine tune what isn't working and reinforce successes. But if people start doing that, some really neat things happen. You see people grow and get stronger and more confident in coping, and that's a beautiful thing.
That's awesome. Would you be able to share an example of one of those skills?
Yeah, a good example is like one skill is you can take out of the clinic and teach for everyday stresses. EMDR is a very well established treatment for trauma. It's very effective. It's acknowledged as a good treatment. But what's to stop someone who's stressed by an argument with the boss to take a minute uh, away from the maddening crowd and just say, okay, what am I feeling? Where am I feeling? What am I thinking? What would be the opposite thought? And then just do a set of eye movements. That isn't something that needs a PhD in psychology to do. There's a whole bunch of skills that are taught in the clinic, cognitive skills, imagery skills, self-esteem skills, happiness skills. It's just a question of how much time do we have, and are people ready to and willing to teach these skills in the various settings where we live.
Mm-hmm. Yeah, so it sounds like they can be small things to kind of get yourself out of your head. Because I'm imagining the eye movements is kind of a way to connect with the surroundings around you. Um,
Yeah, and actually, there's a whole bunch of body-based skills which are kind of interesting. Van der Kolk and Ogden and some others that when we're under stress, the part of the brain that's logical and reasonable and verbal tends to go offline, and so that's not the time to introduce a cognitive skill. It might be the time to do a body-based skill, so bottom up and simple things like, okay, I see you're really stressed here, so what would happen if you just start to track what happens when you squeeze your hand at different ways and just kind of pay attention to what's going on in your body. And that tends to bring back these midline structures that are offline under stress that give us a sense of who we are, a sense of connection to our bodies, to our emotions, and so on. So there's tons and tons of useful skills that can be taught, hopefully before people are in crisis.
Mm-hmm. That's really neat. Yeah, that makes a lot of sense. Because when you're stressed, like you said, the prefrontal cortex is not the one in control at that moment. So one thing that we do in my training is we teach our patients deep breathing. That's kind of the go-to stress management technique, and I feel like that's another way to connect with your body and kind of calm yourself down.
Yeah, that's another body-based intervention. It's been used in Eastern cultures, and now it's starting to be rediscovered in the West, and it's very simple. Anybody can do it.
Cool. Well, we'll go on to the next question, if that's okay.
Okay.
So, let's see. So, I've read some research that suggests that women who experience sexual trauma have like a shattered worldview afterwards, where they go from feeling safe and loved to feeling worthless and insecure, and it's hard to trust anyone, even themselves. And I believe that this is something that's not specific just to women and just to sexual trauma, but this is a mindset shift that can happen to anyone. With your experiences, do you have any suggestions for people who who've seen this kind of shift in their own life? Any way that they could like rewire their brain to be able to think more in a balanced and truthful perspective about themselves and about the world without denying what happened to them?
Yeah, that's a great question because sexual trauma is an intensely overwhelming event that will shatter often self-esteem. And what's interesting in the military, like women in the military sexual trauma is more predictive of PTSD than combat or anything else. And so, third world countries, if they want to break someone, they'll introduce sexual torture along with all sorts of other abuses. But self-esteem is typically a risk factor for PTSD, and it's also a result of traumatic exposure. And so to heal, PTSD either has to be restored or built from scratch. And if there's a silver lining maybe to that kind of trauma, it may be that it's a stimulus to start to build self-esteem that may not have been there prior to the trauma. So, step one is find a trauma specialist, not necessarily a counselor, a psychotherapist, but one who's got training and knows the skills that are useful for trauma treatment. And that's a different skill set than we often teach in our graduate schools.
And you mentioned EMDR as one of those skills.
EMDR is one. There's tapping techniques, and the whole understanding of trauma is that traumatic memories are stored differently in the brain. They're fragmented. They're highly emotionally charged. They may not be totally accessible to logic and verbalization, and they tend to intrude in inopportune times. And so that memory is kind of dissociated. It's not stored like normal memories that have a beginning, a middle, and end, and they're viewed in context with other associated memories. And so the whole principle of therapy is bring that memory to awareness rather than trying to avoid it, and do it in a context that alters the memory. So if I can tell you about a rape and you're a respectful witness, now respect starts to interweave with that memory, whereas before it was shame and hiding. While calming, in a calm state, now calmness replaces hyperarousal. So the principle is fairly simple. Bring the memory, put all the pieces of it together, diffuse the strong emotions, look for those distortions that are embedded in that memory, and that's where something like cognitive processing comes in. But there's lots of different skills, and you want to be, when you deal with someone who's fragile after trauma, you want to be able to have a bunch of skills in case one doesn't work, another type will. And so you really want to be prepared to treat trauma with lots and lots of different approaches. Body-based, cognitive, all kinds of things.
So essentially for someone who's experienced that shift, seeking professional help from someone who's qualified to use those skills is really important.
Right. So I may think of that as phase one, and then either in conjunction with or as an adjunct to trauma treatment, then the self-esteem skills can be learned. Step one might be just heal a bit, because many of the self-esteem skills are fairly cognitive. This idea of unconditional worth. Unconditional love is a little bit more, body level, heart level. and then growing skills, eventually, because if we're not using our skills, we tend not to feel as good about who we are. Uh, but that's where the self-esteem is appropriate and pretty powerful, pretty effective.
Mm-hmm. And then building that can kind of help you be more resilient going forward in the future.
Yeah, the nice thing about self-esteem, it correlates strongly with resilience and optimism and all the things of positive psychology. It's just that sometimes to get ready for that level, you have to heal a bit first. And so,
Mm-hmm.
again, I think we need to do a good job of training our young therapists to be able to run the gamut from negative to, get to positive.
Uh-huh. Yeah, thank you. Um, and this one is kind of related, but for people who feel like they've, played a role in their trauma. I know that you didn't mention this specifically, but I know that in my training, it's stressed like you do not blame the victim. Someone's going to come in and blame themselves for what happened to them, what happened to their son, whatever. We tend to blame ourselves, but what if it really was kind of your fault, or if not your fault, you did X, Y, or Z that put you in the position, that you knew you weren't supposed to do.
Yeah, so we go back to that dissociated traumatic memory that gets stuck in memory in a different way than normal associated memory. So instead of memories files in a file cabinet, it's on the desktop constantly intruding. And guilt can be one of those emotions that are embedded in that memory. And if we don't put that guilt to rest, then that memory becomes even more troubling. And I'm not sure why it's taken DSM so long to include guilt as a symptom of PTSD, but it is now. And in the military, we're hearing a term, moral injury, for maybe it's something I did, maybe it's something I didn't do that I wished I had done, or maybe I simply watched people betray, high values that it's just dispiriting to see that happen. But let's go back to our example of a rape victim. 5 years after the rape, well, maybe if I dressed differently, maybe if I'd gone to that place, and that can eat at a person until it's resolved. And so, guilt is a great teacher if we learn from it and we change as a result, and then let it go. But guilt becomes a problem when it's exaggerated and chronic. And so, there's some really nice aids to dealing with that kind of exaggerated chronic guilt. Ray Scurfield, working with veterans, did this technique called percent responsibility, where how responsible are you if 100% of the pie is all the guilt and responsibility? What percentage do you own? Well, 98%. I did this, this, and this. And what about the other 2%? You sure it shouldn't be 99%? You sure it shouldn't be 97%? Anyway, you go through a process where you look at all the players in that drama. In the military example, maybe my friend died because that enemy sniper is really excellent. Maybe he deserves some of the credit. Maybe my buddy deserves some of the credit for not being alert. And the rape example is, okay, maybe I dressed provocatively and I went to a place that wasn't wise. And so maybe from 98% originally, maybe after this process, I go, okay, maybe 25% is on me. And maybe, the rest of the guilt is shared by the perpetrator, the people who were standing around and weren't protecting, by parents maybe who raised a perpetrator to be violent and malicious and so on. Whatever's left, maybe where it started 98%, now there's maybe a realistic, let's say 20, 25%. The number's not important. It's just something shifted. And then the military has a nice intervention called a kind moral authority, where just imagine you're with a kind moral authority who loves you, has your back, and wants your interests, wants you happy, doesn't want you to be suffering for the rest of your life because of what you did or didn't do. Just in imagery, what would that be like? What do you envision that kind moral authority saying to you? What do we want you to know? Or she, maybe then the person will come up with things like, you were young, you didn't know everything, you're trusting, and so on. Whatever is needed to hear helps shift that memory that had been lodged unchanged maybe for a long time. So there's a lot of encouraging strategies, skills, and I think that the more time goes on, the better we are getting at helping people who are stuck in this negative place.
This is giving me a lot of good ideas for therapy going forward too.
Yeah, you just wish we would have learned this stuff when we were 18 and in graduate school. It's too bad we don't teach this stuff to our young, people early on in their careers instead of having to find pieces and pull from different places.
Well, hopefully some other people will benefit from hearing this too. And it sounds like I really like that piece of the pie thing, especially because you're not like putting blame. It sounds like it's kind of trying to see more of the pieces to the puzzle as opposed to pointing fingers either at yourself or away from yourself, but more taking a like aerial view. Yeah.
I think the difference between blaming and understanding.
Yeah.
I think it's a good healing principle for lots of kind of hurts. I want to understand. I don't want to blame. I want to take accountability for what I can change, what I can control, and let go of what I can't. And that's a nice healing principle.
Mm-hmm. Well, thank you so much. This was very brief but very good. Is there anything else you would like to add before we close? And I'll kind of point people to some resources.
No, I think it's just there's some really good resources out there. I put a lot of years putting a few of those together, and hopefully there'll be some value to others.
Yeah. Would you mind?
There are answers. There are answers. I think that's the guiding principle. Is people get stuck and think, I'm helpless, I'm hopeless, I'll never get better. But I really believe for any hurt, there are answers. We may not have found them yet. We may not think they're out there, but they are out there. And a good healer will, fill up their toolkit with lots of different tools that can heal people.
Mm-hmm. Yeah. Thank you. That's probably the best message we could get to people is that there are answers and there is hope.
Definitely, yeah.
Awesome. Well, for people who want to find out more, either about this topic or about the work that you're doing specifically, where can they go to? I know you have your Resilience First website, so it's resilienceFirst.com.
Yeah, www.resilienceFirst.com. And I think the 3 books that, if I were starting out, that I would be most interested in this topic is the Post-Traumatic Stress Disorder Source Book. That kind of covers the ins and outs of trauma. What is PTSD? What's the nature? What are the treatment options? Self-help, professional, medication, the whole gamut. What are the different treatment modalities? So that's called the PTSD Source Book. And that's kind of the disease end of the continuum. And on the health end is the Self-Esteem Workbook, which are various skills based on the 3 pillars of self-esteem: unconditional worth, unconditional love, and the process of growing. And then the Resilience Workbook is a whole range of resilience skills that ideally are taught preventively, but if somebody's in recovery from drug addiction, they're useful to just about anything, but regulation, arousal regulation, growing character, inner strengths, resolving guilt sometimes is step 1 to that process. But again, there are a whole lot of skills that can be really useful. So I try to put those things under one or two or three covers.
Well, thank you so much. I'll put links to those books when I post this and onto your website. I also love the quotes on your website too. There was one that said, under, you have like a page for quotes about resilience, and there was one that said, in a in the middle of winter, I have inside me an invincible summer, or something like that.
Yeah, Camus, I like that one too.
Well, thank you, and we're gonna say goodbye. Thank you for watching.
It's a pleasure to chat with you.
You too.
Good luck. Good luck.
Thank you. Okay.